Natasha, welcome to our UKDHC podcasts. We've invited you because you won first prize for your podium presentation at our annual scientific conference in September 2024. Before listening to your paper, we would like to learn more about yourself, how you got into research, and what career aspirations you have. So, let us understand a little bit more about you, Natasha. Tell us.
Okay. So thank you for inviting me here to speak, and it's a pleasure to be able to talk a bit more about our work. I'm a clinician by background. I'm actually in obstetrics and gynecology, and a senior registrar in London. And I guess I got into this work because urine infections are just a big problem within the female half of the population. It happens all around, but it's particularly more common in women, and it plagues women at different phases of their reproductive life. So pregnant women suffer from it in a different way, and the tests don't work well on them. And similarly, postmenopausal women are more prone to them, and so on. So urine infections are quite relevant in the context of obs and gynae. But the urine UTI kind of world is also just fascinating. The more you look into it, you realize that the fundamentals of what we know are based on science that was done a long time ago in the 1950s. They remain the basis of what we use today. It requires some updating and modernizing through the use of technology, particularly with AI, machine learning, and which is where my project comes in, where we use computer vision to automate uromicroscopy as a more accurate and reliable bedside test for UTI detection.
So have you always been in London? What has your career path been?
Yeah, so I went to medical school in London. As you can tell from my accent, I'm partially American. I have spent time overseas, particularly in Singapore. But then when I came here, London just feels like the right place. And it also has lots of fantastic opportunities, and I don't feel quite so far from home, despite being on the other side of the world, because the food here is also great.
Well, I've also been in America. I spent 9 months doing research actually in Canada, and then we did a little trip around America. And I've also been in Singapore as an examiner for the fellowship, the Royal College of Surgeons fellowship exams. So I know both countries. And where would you like to be in 10 years' time? What would you like to be doing?
That's a really good question. I would like to still at the core of it, I consider myself a clinician. So I'd like to still be doing what I love now and hoping that I love it in 10 years' time. That's kind of obstetrics and labor ward and kind of the excitement of that. But I'd like to also be able to continue these skills that I've developed in programming and designing models and thinking about the clinical applications of it. I'm not sure whether or not that'll be within the actual coding aspect of it, because I think that's a skill and language that needs to be maintained. One that isn't quite immediately useful in the NHS, but perhaps it's more in the deployment and the implementation of it and validation of it within the clinical context.